Welcome back, everybody. We have Gary the ER nurse with us today. If you don't follow him, you should. If you were following him, you still need to go follow him again because TikTok did some sketchy shit and got rid of his account for some reason. So he is making a comeback. I'm kind of curious. You said you're from Virginia. Where at in Virginia? Roughly. I mean, you don't have to say an exact place.
Right. No, I'm in Southwest Virginia.
I'm born and raised in Northern Virginia, kind of just outside of Fredericksburg. I always enjoy running into a fellow Virginia native.
Well, so I'm not a native of Virginia. I'm a military brat. My dad just retired here in Virginia, so I've lived all over the place. He just happened to retire in Virginia, and I kind of stuck around for a little bit. After I graduated college, I moved out of the state, went up to Michigan for a little bit, and then I came back down, and I've been here for most of my life.
So tell me a little bit more about your career. Have you always been in nursing? Did you do anything with, EMS or anything like that?
Yeah, so I've had a very interesting and diverse professional background. So I knew very early in my high school athletics career that it was not going to go beyond high school. But I love sports, so I wanted to do like sports broadcasting. And so when I was a sophomore in high school, I actually got into broadcast journalism and did play-by-play for sports that I didn't play. I did local public radio. I interviewed people. It was a really good opportunity, and I carried that with me to Virginia Tech, where I got an undergraduate degree in communications, which a lot of people roll their eyes at. It was still a very challenging career, and I did broadcast journalism. Worked in television for many years, was an on-air weekend sports anchor, reporter, and then I switched over to radio again, and then went into newspaper, and actually I'm a 3-time Virginia Press Association winner for my writing, which was awesome. And then in 2003, I met my first wife, who was heavily into EMS. And so she pulled me into that EMS world where I'd never previously considered that. So in 2004, January 12th, 2004, I became a cleared EMT, basic. And then a year later, I became a volunteer firefighter. I was a firefighter 2 in Virginia. It's a firefighter 2 hazmat operator. Did all of that stuff. And I still have all my EVOT classes. And so I did that for a number of years, and then that marriage did not work out. I left EMS altogether. And then 2007, I got back into 2017, I got back into it locally where I live now, and I've been running for the last 8 years here. I was able to challenge to get my EMT back, because along the way I decided to become a nurse, and that was really my wife's decision. But I'm glad she made it. She knew I wasn't happy with the job that I was doing. I was working for a university, seeing how the sausage is made. And she got sick, and she's fine, but she got sick and had to have surgery, and I had to nurse her back to health. And during that process, she was like, "You'd make a really good nurse." And I said, "Well, I love you." Like, I don't know if I could do that for everybody. But lo and behold, she had kind of done all the math, and she's a CPA and had done the numbers and crunching, and I decided to give it a shot. Went back to nursing school, graduated in 2016, so I'm in my 10th year as a nurse. I've been running rescue locally for the last 8 years. And it is, I feel like a calling for me on both respects. Like, I'm able to give back. The volunteer stuff is like, I have a skill that I can give back to my community. And I love that very much.
So you've been a nurse about as long as I've been a paramedic, because I graduated that year as well. Got into it a little bit before that, but same general time frame. So have you always done ER, or did you kind of start somewhere else and work your way into it?
When I first graduated, I applied for several jobs. I was offered a job at a step-down, cardiac ICU step-down, but it was actually, it didn't pay as much as I made as a student nurse. So I was like, I can't take that kind of pay cut. It would be making less money than I did in my previous career, which was wild. Yeah, I was like, I can't take that. Like, I made more money as a student nurse. And then the hospital that was actually right next to our house, like 10 minutes away, they offered me an ER job, but I was holding out for an ER position at the VA hospital, which is where I did a year-long externship and got paid for it. And it's the federal government. It takes a long time. And then finally I was like, I got to work. I got to get a job. Like, I can't wait for this. So I go back to the local ER. They said, well, we filled that position, but we do have an ICU job open if you want it. And I said, I'll take it. So I started my career in a medical surgical ICU, and I worked for a year there. And then I ended up running a code in that hospital, and at that hospital, one ICU nurse and one ER nurse comes to those codes, and they basically run the codes. from a nursing standpoint. And that nurse, who I'm still friends with today, I run rescue with her, she was like, you need to come to the ER. And I was like, okay, let's do this. And so I applied for it, and I got the job, and I've been in the ER ever since.
So tell me a little more about what you're doing now, specifically with your own podcast and also TikTok. What is your, I guess, kind of your vision for what you're doing and what you're trying to achieve now?
So the podcast is something I had been thinking about for quite some time. As I mentioned, I have a background in broadcast journalism. I am comfortable being on camera. One of my strengths has always been interviewing people. It's what I always did. And I thought, what better way to bridge those two worlds, healthcare, where I help people, and then the journalistic side of that. And what I tell people is, look, I am not the smartest nurse, and I am not the smartest EMT. But what I do well is interview people, so I can find smarter people than me, bring them onto the show, and they can share their knowledge with all of us. And then I get better, and then the audience gets better. And then I can just find these people that have a special talent or something that they're passionate about, and they want to share that with other people. And I thought that was the best way to do that, was to start a podcast. And as far as TikTok was kind of this launching pad for this, right? I'd been on TikTok for 6 years, slowly building up. And then the last 18 months, I really ramped up. Like, I thought, okay, we're gonna really ramp this up and put out more content. And I did. And I was slowly building. I got up to 29,000. And then like 3 days ago, I woke up to do my normal morning live, because every time I do a live, you get more followers, you reach more people, you build that audience. I logged in and it said, your account's been permanently banned. And I was like, wait, this got to be a mistake. I've never had a strike. I've never had a warning. I haven't had any posts taken down. I haven't had any comments taken down. Every now and then I would voice my opinions on political things, especially as they related to healthcare. But like, it was nowhere near as vitriolic as you see some of these other content creators with millions of followers, right? So I was totally flabbergasted. But being 50 years old, and I have been down and out several times in my life for personal reasons. I've lost my job. I've been unemployed. This was a minor inconvenience relative to the real world struggles that people are having. So I felt bad for about 2 hours, and I thought, well, this is what I preach to people. You can either feel sorry for yourself, or you can get right back up and get back out there and do what you love. And just because I have a smaller audience doesn't mean that audience isn't valuable and doesn't want to hear things. So, I just picked myself up, started a new account, and got right back out there putting content out there. That audience, I built that up. They'll come back. And this is just a lesson that it's all relative. This is just a social media account. Yes, it sucks real bad to lose that in a blink of an eye for no reason at all. But at the same time, what power do I have? None. I have the power to control what happens next. And that is get back out there and just keep doing what I'm doing.
I definitely have felt for myself over the years that working in public service as a whole has given me a greater perspective on the problems, and that we take for granted the first world problems that we have that on the grand scale are not that important. Like, yeah, it sucks. It's a lot of hard work that's lost, but there's a lot more to life than this.
Exactly. And I have people that follow me that have real world problems, that are going through things right now. And it doesn't seem right for me to get on there and cry and be upset about it. I think the better approach is to lead by example and say, yeah, this was unfortunate, but it's a minor inconvenience. I'm just gonna get back up and keep going. And this is just a small thing. At the end of the day, it's a small thing. It's not a big deal, and we'll just move on.
Well, and I think that highlights the issues that we face definitely in EMS, and I have a feeling y'all deal with some similar stuff in nursing, where we hope that someone's coming to save us, when in reality it's our job to pick ourselves up and address the issues and actually fight for ourselves. And
right.
I feel like we've lost that in general, and that's why my wife and I both started this, because we're not anything super well, she's smarter than I am when it comes to medicine, but we're not anybody special per se. We're just two people who have a voice, who care, who want EMS to be better and want EMS and nursing to get along. And why not share that with everybody and say, hey, like if we can do it, you can do it too. There's a lot of good out there that can happen if we actually try.
I agree. Yes. And like I've met so many smart people on here, and then to have like maybe some younger people reach out to me and like ask for my advice, and I kind of feel like I have life experience, and I'm happy to share that with you. I love what I do. I work with way smarter people than me in both EMS and the ER. And maybe I'm underselling myself, but at the end of the day, I try to surround myself with people who are better than me, because I feel that lifts me up. That makes me smarter. And I think it's served me well. I feel like I've done well in my EMS career. I've done well in my nursing career. But one of the things that I learned very early on from my mentors, especially as I was going down the flight nursing path, was find people that are smarter than you and surround yourself with them, and you'll be a better clinician.
What are some of the big things that you're trying to address in the nursing community, specifically nursing culture and general workplace issues?
I think two of the big things are the nurse bullying that is prevalent everywhere. It doesn't matter where you work, it's going to be there. I've never fully understood that. I have not experienced that probably to the level that, say, a new nurse grad who's fresh out of college, who's 22 years old, has not been through it before and doesn't know necessarily how to stand up for themselves. So that's one of the things that I like to address. And I like to bring on people who have an active voice in that. One of the podcast episodes that I have coming up is with Anna, the ER nurse, and that is one of her great passions. Like, she loves to mentor new nurses, new like nursing students that come through her ER, and try to help break that cycle and educate those young nurses as to what they should expect from their colleagues and what is acceptable and what is not acceptable. And like I said, I've not personally experienced that, and I think that's because I was a second career nurse. I'm a big guy. I'm 6 foot 210. Not many people are gonna get in my face and bully me, especially in nursing.
Mm-hmm.
But that young nurse who's 22 and is scared out of her mind going into an ICU or an ER, yeah, I think it'd be really easy to pick on them. And I want to try to break that cycle and make sure that doesn't happen. We need to end that eating their young mentality, and it's still pervasive today.
Now, when you say nurse bullying, you specifically referring to like internally, like other nurses bullying, or broadly speaking, other professionals or patients and whatnot?
No, usually it's internal. It's more experienced nurses who are belittling or making new nurses or younger nurses feel inadequate, feel dumb, make them question their decision making, like questioning their education. Like, why don't you know that? You should know that. And then they might be a couple of nurses at another nursing station that are gossiping about the new nurse that's sitting over at the other nurse's station. They'll exclude them from things. They'll report them. I mean, it can get really, it's mean. It's like Mean Girls, but it's not exclusive to girls. Like, there are male nurses who bully as well. It's just, but people talk about like the Mean Girls mentality, and it's, non-gender specific. Anybody can be a bully, but nursing is predominantly female, so you get a lot of that kind of stereotypical stuff that you see. But yeah, mostly what I'm talking about is nurse on nurse bullying.
What kind of issues do you deal with locally as far as any conflict between EMS and nursing? Or do y'all generally get along fairly well?
So I feel like where I work, there's a lot of crossover. There are a lot of EMS that run locally also work in the hospital. So we have a lot of nurses that are also paramedics and EMTs like myself, who also then work locally as a nurse. The agency that I run at is actually all volunteer, and it is one of the largest, if not the largest, all volunteer rescue squad in the Commonwealth of Virginia. We have over 150 active members. We are staffed 24/7, and I don't think we've turned over a first team call in 3 years. We are routinely running 2 and 3 ambulances deep. We staff 6. We have cave rescue. We have rope rescue, trench rescue, extrication, swift water. We do all of it. And we do that on a regional basis, search and rescue. We do all that. We're very fortunate that we have 3 medical schools that all kind of feed into that. So we always have a fresh supply of medical students and medical school students who come in and work with us. So I don't feel like there's that, when you get on social media and you see that, paramedics and nurses butting head and resentful of each other. We don't see that as much here. Now, when I go to where I work, we sometimes see that, not very often. And I work at a VA hospital, so I think the EMS crews that come in are very respectful of what we do. We are very respectful of what they do. But I do know that at the larger hospitals, like the Level 1 Trauma Center, I know that kind of stuff goes on every single day. But where I run, like we all work at the local hospitals, and then we go run rescue. So we're very respectful of each other in that regard. And I've heard about the other horror stories about that, but I've not experienced it locally, and I'm grateful for that.
I definitely feel like it's gotten better, ironically, almost since COVID. Like, because at least around here, we had a huge influx of nurses right around that time. And it seemed like that was kind of a bonding experience for everybody, because we're all like, it all sucks. We're all miserable, and we're just going to make it work together and embrace the suck. So I feel like that helped, at least around here. But yeah, I'd forgotten that Virginia was mostly volunteer EMS for 911. Down here, volunteers just don't exist for EMS at all. It's all paid now. Sorry, my back is, like I said, about 30 years older than me.
Yeah, our agency, like a lot of the local agencies that were volunteer, were like, they're shutting down because they can't staff it. So our county actually ended up hiring full-time fire and EMS to help cover all the calls in the county that we weren't getting. Like, we can't get to those. They're third due. We can't get to that. We were getting dispatched for that third due, like 30 minutes away, and that pulls us out of our first due. And as a volunteer organization, that was like straining our resources, right? Because then we're out there, and then we get 2 or 3 more calls, and now we're like really stretched thin. So like I said, we're fortunate because we have 3 medical schools that all feed in there. So we always have fresh EMTs and paramedics and drivers and all that kind of stuff. So, but the surrounding areas that aren't local to the medical schools, they don't have that, and they are shutting down left and right.
Now, and you have the advantage of being somebody that works in both right now, is from a mental health standpoint, what do you see? What are the things that nursing deals with from a mental health perspective that maybe the rest of us who just work in EMS don't see or don't fully comprehend?
Are you talking about like the bad stuff we see?
Well, more of, I mean, because we all see the bad stuff, but
Right.
Working in EMS, obviously you're out in the wild. You don't have as much help, you don't have as much stability. So, there's kind of some particular challenges that we deal with that in nursing you don't necessarily deal with as much. But is there, I would imagine, and this is more what my question is there additional burdens on hospital staff, whether it's because of patients or administration or whatnot, that are particularly affecting the mental health in that industry?
Yeah. So what I would say to that is, and I thank you for explaining it, because now I understand what you're asking. Yes. One of the things with EMS is typically you are 1-to-1, right? You go out on a call. That's your one patient. You assess them. You treat them appropriately. You call it report. You get them there, and then you're only going to have one patient at a time. But in a hospital setting, especially in the emergency room, when EMS brings me that patient, I have maybe 3 other patients that are all equally as sick or in bad shape, and so now you've got to get this patient in. And I mean, that's part of the job. It's just something we learn to deal with. But I think one of the things, and I experienced this when I had to orient a flight nurse, right? A flight nurse who hadn't been at the bedside in like 20 years, had been in flight and decided to come work in the ER. And you're thinking, well, this is a flight nurse. This is a flight nurse with a dual certification as a paramedic. I can't teach them anything that they don't already know. To which I had another friend who was a flight nurse that said, actually, you can teach them, and they're going to need you because they're used to one patient. 1-to-1. And that's what they've been doing for 20 years. And now you're asking them to take 4 patients. So they need to learn how to manage that. Now, they have the skills to do all the things for all 4 of those patients, but they need to understand that they need to constantly reassess all 4 and not just that one. And that changed my perspective, right? And so now when I think about these paramedics who have been running nothing but EMS for 15, 16 years, like paramedic to RN John Smith, he was a paramedic for 13 years, decided to become a nurse, and he gets there and he's like, oh, now I have 4 patients. I'm not used to 4 patients. So I think that added stress, like on nurses, is not something that I think EMS paramedics are used to. So you get that one bad call, and I do this as well in EMS. You get that one bad call, you think about that one bad call. But when you work in the ER, like you're thinking about all 4 of those patients. Like you're thinking about that vent patient, you're thinking about that one that's got the PE, you're thinking of the one that just had the MI, the one that you just shipped out for a stroke, and like you are trying to process all of that times 4 versus just the 1-to-1. So I think that's one of the first thing that jumps out to me.
Now let me reverse that. What's something that you feel EMS has to deal with, has to manage, that maybe nursing doesn't quite understand or doesn't relate to and doesn't maybe think about it as much?
Well, I think it's obviously the lack of resources, right? So in the ER, I need respiratory, I call respiratory. I need a central line, I call anesthesiologist. I just call whoever I need and they will come down and do what we need to have done. But when you're in the field, like it's you and your truck and your crew, and that's it. You don't have a physician, you don't have access to all that. So I think one of the things that nurses who don't work in EMS, sometimes when the crews come in, like, did you do this or did you do that? Do you have a line? And they're like, no, I don't have a line. Why don't you have a line? Well, because, and like I see it from the perspective of like, because they had 1,000 other things they had to do, and that was probably way down on the list of priorities, right? And I don't think that's something that nurses who don't work in EMS understand, is that crew is doing the best they can with the resources available. And also, we're not on scene. We don't know what other factors are playing in. Family at the bedside, or police there, or fire, a busy scene or a not safe scene, where you're not 100% safe. I know scene safe BSI is the big thing, but, I think a lot of us tend to maybe not pay attention to that as much as we should, and that's the running joke, scene safe BSI. And then you step in. But sometimes we step in and we don't maybe do a full 360 and see what's going on. And nurses don't understand that. We live in a controlled environment, a locked unit, like nobody gets on there that we don't want in there. And then you're out in the wild on the scene. And I mean, there's just so many factors that I don't think nurses understand. Medics, drivers, EMTs are constantly having to have their head on a swivel to figure out like what is changing in real time right now, and how do I care for my patient while still monitoring all the other input that's coming in. And I think that's probably the one thing that nurses that don't work EMS don't understand about working out in the field.
I'm gonna ask you or maybe not ask a question, but pose a statement that I don't believe in, because I have developed good relationships with the nurses around me and I understand this. But the average Joe paramedic loves to say, well, you have to have orders for everything. You don't have to think on your own. What is your response to that, based on your experience?
Yeah, so you do have orders. Like, you do need orders. You just have standing orders, right, from your OMD. Like our agency, we have orders that are standing orders from our OMD. We have a set list of protocols that we can operate under, and if you're a paramedic, then yours is broader than mine as an EMT basic. But I don't think paramedics understand how much we have as nurses in the emergency department. We have that same kind of broad authority. We have order sets that include medications, right? So a chest pain comes in, you're having chest pain, shortness of breath, left arm, when you meet all the ACS, right? All the ACS signs, you're checking all those boxes, boom. I just put in a chest pain workup, right? That includes everything that we need to treat you, and I don't need a doctor's order because I already have one. It's a standing order approved by our chief of medicine. And so I would say that's a clever argument, but it lacks context, right? Like, you're skipping a big part, and that is you have an OMD who wrote those orders a long time ago.
If you enjoyed this episode, be sure to follow us on YouTube at paramedicaf, or you can subscribe on Apple Podcasts and Spotify at the Paramedic AF Show. You can catch up on the Daily Debrief, kind of a sub-show within the Paramedic AF Show, or you can watch our full-length episodes, including interviews and discussions on leadership, culture, personal wellness, mental health, everything related to daily life in EMS. Make sure you hit like and subscribe.